Welcome back to Across Louisiana. You know, for families in the Baton Rouge area, health care is key, and there's a big disparity in some of those families in the primary care that they can receive. But there's an organization that's taking care of that. It's the Capital City Family Health Center, and here to tell us all about it is Rhonda Litt. Welcome to the show, Rhonda.
Hi, thank you.
For people who might not be familiar with the center, tell the folks a little bit about what you provide for Baton Rouge.
Okay, Capital City Family Health Center is a private nonprofit 501c3 corporation. It's been around about 16 years. We're a federally qualified health center, which means we receive designation from the Department of Health and Human Services and a small grant to subsidize costs. The cost of care for the uninsured, but they expect us to operate as a business. So we also accept private insurance and public insurance, which includes Medicaid and Medicare. We offer primary care, dental services, behavioral health services, and we have to serve all life cycles from birth to death. It's very comprehensive. It's a one-stop shop.
Yeah, I mean, I was surprised that you really provide, I mean, everything that you need pretty much in one place, right?
Absolutely, absolutely.
You mentioned the FQHC. Explain to me why that's important in the context of the center.
Okay. It's really important in the context of the community because you have most of the population here that are uninsured, and there's very few providers who are actually accepting people who do not have insurance. We'll go according to their household income on the basis of a sliding fee scale up to 200% federal poverty level. That way, that grant will subsidize the cost of that care, and then they'll be responsible for a portion of also for their services. But it gives them the access to care, quality care that they need, healthcare services that they need. So that's the importance, especially when you have a high percentage of people who are uninsured or underinsured.
So really a lot of people who could be taking advantage of this may not realize that they qualify for the services,
absolutely,
right?
Absolutely. There's some documentation that's required that you bring in so we can determine exactly where you fall on the sliding fee scale, and then some other documentation, a social security card, your last pay stubs, or if you're not working, unemployment benefits or things like that. There's actually criteria that we have to collect so that if we're audited, that we can actually, support that, we're providing services and giving services to people who actually qualify for it.
Well, I know it's not just services you provide. There's some events coming up. Tell me a little bit about that.
Okay. For the month of May, we actually are celebrating an employee wellness, health and wellness program initiative. And that's just to focus in on if we're not healthy, we can't help you be healthy. So we're focusing on just different health topics every month, especially Medicaid expansion for some folks. We have some employees who are not insured. But also just talking about just some ways, intervention for self-intervention so that we can improve health within the employee sector, as well as focusing in on women's health. There's a week, I think it's May the 13th through the 17th, where we're going to focus in on women's health issues as well.
Fantastic. If people want to take advantage of that or find out more, where do they need to go for more information?
Okay, you can go to www.ccfhc.org, or you can call us at 225-650-2000.
Terrific. Thanks for all you do for the community.
Thank
we appreciate
you so much.
You coming on to tell us about it.
Thank you for having me.